What's your connection to healthcare reform?
I would like to see it happen since I have no health care.
What's it like not having healthcare?
It's a lot different from when I was a real person and worked at the power plant as an engineer and had a good job and good health care paid for by the company. And now, since I'm disabled, I get Medicare. And Medicare is not, I'm happy to have that, but it doesn't take care of medications. There's a lot of medication that I just don't buy because I don't have the money to buy it. And then there's some that I buy and I might take it every other day instead of every day. And I'm trying to lose a lot more weight so that I don't have to buy as much insulin because my insulin level will decrease, so I won't have to take as much the more weight I lose. So that would help too because it'll be cheaper. A lot of people think it's a communist plot, okay? I don't. I think if there was health care available to everyone, the type of health care where you could be proactive instead of reactive. You can take care of some problems when they first hit or before they hit, and that way you don't have to be reactive and spend even more money when this person comes down with this big disease because it would have been discovered and taken care of because they didn't have to worry about not going to the doctor because they didn't have the money to go to the doctor for the tests. People have suspicions because they don't understand what's going on, and they will be suspicious until it's explained to them. It's knowledge. They have to be trained and taught what would be better for everyone. There are too many people out there that don't have health care, people that are underinsured or uninsured or underemployed or unemployed. And what can they do? I know there are some crooks and welfare cheats, but that's minimal. The majority of the people trying to get help really need the help, and they use the system the way it's supposed to be used. I've always wanted to help people. I believe in volunteer work. In fact, I had my children going to Central State Mental Hospital in Indianapolis when they were 9 and 10 years old on the weekends to help the people there. I knew I didn't have money to give to these organizations, and they were really worthwhile organizations. So I thought, well, I can put my time to it, and that's what I do.
And I've told them in our legislative meetings. We have legislative meetings with League. I would say, please, why can't we have health care where you and all of us are part of it and we have the same treatment?
I believe that health care should be available to us equally, no matter what our position in government, no matter what the age, no matter what the occupation or inoccupation. If I total it, 3 months of my Social Security go into my supplemental health care for my Medicaid. Luckily, I am a very good fiscal person. I grew up in the Philippines, and I was a survivor, a 9-year-old survivor of the Bataan Death March. And also, fortunately, I have reached the age where I am not afraid to speak my mind. Usually in the Philippines, you may only talk if you have you may only have yourself heard if you are old enough, or if you are over 40, or you have a PhD. Well, I had a PhD, but that was not enough. You have to also be old enough. So now I can feel free to speak my mind. And I speak, you know, they listen to me, but they do not follow with their legislative stance. And I think they cannot help it because they feel obligated to the ones who got them in office. And I still feel that once they're elected to office, they should feel free to work for their constituents, all their constituents. And I know they're intelligent. you know, I'm a member of a lot of organizations. League of Women Voters is only one of them. Public Citizen, Physicians for Social Responsibility, a whole lot of others. I'm for the environment, but all of these relate to health.
What do you think America would be like with universal health care?
We would save a lot of money, and we would be a lot happier. And those of us who are hit in their consciences for the because of the sufferings of people, we would die comfortably, knowing that things are right for them, are finally getting right for them. But you know, every time you hear the news about cuts always being made on the backs of people who least can afford it.
My name is Becky Temple, and I'm a retired nurse. I live in Pittsburgh, Pennsylvania with my partner and our daughter. My partner was diagnosed with a benign brain tumor. She elected for the medication to try and shrink the tumor. It was sort of experimental at the time. It left her unable to work as a nurse, unable to work really at anything. She would lose words. She would drive in the car and forget where she was. She lost her health insurance for herself and for our daughter. It was horribly expensive to buy insurance. We ended up needing to sell the house. Eventually she ended up filing for bankruptcy because she couldn't pay her bills, and I tried paying her bills. I got a second job. I worked 2 jobs for a while. I became sick with bronchitis. I got really, really sick. There was no one to help. We were nurses, we knew the system, there was no one to help. I've since learned that in the state of Pennsylvania, where we live now, the #1 cause of bankruptcy is people with medical bills who don't have insurance or don't have enough insurance. It appalls me that we are the only industrialized country in the world who does not provide basic health care. One of the things that I do to try and help that is I volunteer at an organization called Healthcare for All, PA. The bill that we are trying to get passed is basically like a Medicare for all. If enough people make enough noise, it will happen. It can happen.